Had gone a year with COVID and a ER that remained completely empty until the vaccines started coming out, and then all of a sudden everybody was sick. Everybody. I think the world needs to know what truly happened in these last 3 years and what medical professionals have been seeing all along.
We're live. Can you tell us your name?
Anna.
And you're a nurse?
Yes, I'm an ER nurse working in Greenville, South Carolina, currently.
All right. And you work through the COVID era?
Yes, yes.
Okay. So tell us about what you saw.
So we originally started seeing COVID patients in early 2020. Started like in the winter going into the spring. First thing I noticed was that the ERs became very empty. Everyone was scared to come to the hospital. So at least here in this area, the ERs were empty of patients. And nobody was coming in. For about a year, it stayed like that. Despite the news reporting that like every hospital was overloaded and crowded, and nothing like that was happening. We were being sent home because there was no work to do. However, we did get some people coming in that were concerned because their symptoms matched COVID symptoms. And back then, the only COVID test we had was a nasal swab that took 3 days to come back. So essentially, if you came in, you would get swabbed, and if you were sick enough to get admitted to the floor, you were either sent to the COVID ward or the general floor where everyone else went. However, since the test took 3 days plus to come back, anyone with COVID symptoms, it didn't matter if they were elderly, immunocompromised, children, whoever, if you had COVID symptoms and that matched a specific, I don't know, back then it was just, cough, shortness of breath, fever, and a host of other things. If you matched those symptoms, you were sent to the COVID ward automatically. And if your test came back negative later, then it was too bad. You already got exposed to all the COVID patients on the COVID floor. So I feel like a lot of elderly immunocompromised people got exposed to COVID unnecessarily during that time and died in the hospital when they never even had COVID to begin with. And that's how a lot of it was spread, was through the hospital system. When the rapid tests became available, they were still not using them on everybody, but we slowly integrated to where now everybody gets a rapid test. So in 30 minutes, we know if you for sure have COVID or not. But back then, it was just a matter of if the doctor believed you had COVID, you got sent to the COVID floor.
Did you have it marked down as COVID on your records?
Yes. Yeah.
Whether the test came back or not? It was a guess.
Yeah. At least for us in the ER, yeah. We were just guessing. A lot of patients that did come back COVID positive didn't even have respiratory symptoms. They had abdominal pain, they had diarrhea, they had other symptoms that didn't match respiratory symptoms at all. So the virus itself was all over the place in terms of the symptoms, but we were told to look for a specific set of symptoms. And if the person had it and they were sick, they went to the COVID floor.
Did you, as a nurse in ER and an experienced nurse, did you trust the COVID rapid test? Do you believe that it was accurate every time?
No. And a lot of people would take home tests and then come in and get the rapid test, and we'd get differing results. So personally, I didn't trust the test at all. But if you got a positive at all on the swab, like the COVID diagnosis went down on your record for sure.
And even if you didn't, it sounds like you already sent to the COVID ward. So
yes, initially, yes. If you had the symptoms, yes, you were basically labeled as a COVID patient.
So what was the kind of memo going? Because you weren't on the treatment side, right?
I was not. We did stabilize those that were severely sick and needed to be intubated or, given respiratory support, and then we would just send them off to the floor. But there was talk among all the nurses that those that did go on vents just never came off of them alive. And that was just the general consensus among everybody, that you don't put your loved ones on a vent if you can help it.
So all of these people you're seeing here died from the hospital protocol. You can see them around this bus.
Yeah.
So they're reporting that when they got to the emergency room, one of the first questions they were asked is if they hadn't taken any COVID shots.
Yes.
And when they said no, they were treated not very kindly. Did you experience any of that from the ER?
I can't say that I did. I mean, personally, I am one of the nurses that greets patients when they first come in the door, and I am completely unbiased when it comes to that. But a lot of my coworkers actually refused the vaccines because we saw initially what happened to the first group of people that took them.
What did you say?
We almost immediately saw an increase, tremendous increase in the level, a number of stroke patients. We saw the number of patients with blood clots in their body, in their lungs, in their legs, people having unexplained heart palpitations, numbness, paralysis, just unimaginable numbers. We were in the spring of 2021 the busiest we've ever been as an ER. It was complete chaos, and that's being said, COVID had been going on for a year then. It was not COVID that was making people sick. We had gone a year with COVID and a ER that remained completely empty until the vaccines started coming out, and then all of a sudden everybody was sick. Everybody. The amount of stroke patients we saw was unreal, and it was people from like their 20s to elderly patients. We saw devastating neurological deficits in young people that would probably never recover. I talked personally to a girl that half her body was paralyzed, and she admitted it became an onset after her vaccine, and she was still considering whether or not to get the booster shot, and because she wasn't certain that the vaccine had caused that. But I was like, what else could it be? You're so young, and this came on so unexplained and so quickly. And we had so many patients like that. But anyway, the nurses, when it came time for the vaccine mandates to go into play, were adamantly against being vaccinated because of our witness to what was going on with the general population. And we actually fought against it, and we were able to lift those mandates in our hospital systems here in Greenville. Nobody was forced to get vaccine, as long as you signed a religious waiver, and we were able to do that. So
do you think, now that we're the end of 2023, do you think that people are just not, the whole world is waking up? Because we're hearing only 2%, and we heard 7% took the booster. Or are you seeing as much injury still coming in from these shots?
I think people are starting. There's a good percent of the population that is still getting the boosters, and we are still seeing an incredible amount of people with heart problems.
Young
heart
people.
Problems, especially. Yes, young people, old people, everyone in between. So I cannot speak to what could be causing that for sure. But this is just the trend we've noticed, that in the past 3 years, these problems have become exponentially worse in the general population.
Well, they started vaccinating, or it's not really vaccines, they started giving the COVID shots to 6 months and above. Are you seeing any babies coming in?
We don't typically see babies. There is a children's hospital in this area. If the babies do come in, they are typically very sick and shipped off right away to the children's hospital. I haven't personally witnessed any babies with heart problems, but I have seen teenagers admitted with heart issues that were unexplained. And mostly we were seeing enlarged hearts, hearts that are beating too fast, lungs that have blood clots in them that are unexplained, and of course strokes. We're still seeing a lot of those.
Did you see anyone die from these complications in the ER?
We saw deaths. It's hard to prove that they were traced back to complications related to anything to COVID or the vaccine. We also saw a lot of babies that were miscarried. I would count those as deaths as well. A lot of women lost their children during this time period. Our miscarriage rates have gone up tremendously, to where every day we're seeing multiple women miscarrying their children. And that's just, it was not unusual in the ER before, but now it's becoming just typical, everyday thing, unfortunately.
Late miscarriages? Or just generally?
General. We've had a few late ones, but a lot of ones, in early pregnancy especially. So it's hard to, again, prove that any of that ties together. This is just the trend I've noticed over the past 3 years. And that's the only thing that has changed in the ER world, is that people are getting the booster shots yearly now.
And you're seeing them coming in from the booster shots? Yeah.
Yes. Well, initially, we were seeing people come in right away after getting the shots, experiencing dizziness, nausea, panic attacks, just immediate symptoms. Like they would get the shot and they would go straight to the ER because they felt so unwell. Doctors would come in.
That had taken the shot, doctors that had taken the shots.
They would come in saying they didn't feel well at all.
Do you think they understood it was from the shots?
I mean, I was not allowed to speak to them about that, but
Because it's off limits.
right, we don't ask, if you believe this is caused by a vaccine. Nobody talks to the patients about that.
Do you know why you're not allowed to do it?
I think in the medical world, there's an expectation that we are to uphold what the CDC recommendations are and what the hospital policy is. And so if shots are recommended, if vaccines are recommended for everybody, we are not to question that. And if we are seeing people coming in with unexplained symptoms, we can't automatically assume they're vaccine related, because that would cause fear and stigma for the vaccines. And that's not what the health community wants. They want everyone on board with vaccinations. So we're not allowed to question people that come in and say, do you think vaccines cause this? We're just to ask, did you or did you not get vaccination? And that's the only thing.
And it's just marked down and forgotten about?
Yes. We move on. We never bring it up again.
So is the ER quiet on the 1st of November 2023, or is it busy?
This time of year we're starting to pick up. Usually this from November on, we call it flu season kicks in, which interestingly enough, we had no flu patients in 2020 or 2021. And we had flu come back yesterday, made a comeback last year. So we were seeing flu, strep throat, and COVID mostly all winter long.
What's the difference between flu and COVID?
It's an interesting question. All I know is there's two separate tests, and one test comes back for flu and one test comes back for COVID. And a lot of symptoms are very similar. I think COVID does have the tendency more so to cause blood-related issues.